time to get a quick pulse on politics. Shout out to Councilmember Thomas for joining us. Councilman, how are you? How's everything going in the midst of all these changes?
I'm as good to be expected. Thank you for having me. Thank you to the listening audience. And this has just been a great show, another great show so far. So, I appreciate it.
Appreciate you. So, it's Thursday. This is usually, when we have city council happening. I think I heard that it was postponed this week, but correct me if I'm wrong.
So, yes, you're absolutely correct. City council this week, unfortunately, was postponed. Last week, we also did not have session because of and that was expected because of the Easter holiday. And the week before that was when we did convene to vote for the $85 million to be dispersed to the mayor's administration to help fight coronavirus.
Got you. All right, so we're about 2 weeks out from the last time you all convened. Of course, at this point in time with the pandemic, on a day-to-day basis, there are always like new updates and things just to stay in the know of. So nonetheless, thinking about what that means for 2 weeks, in terms of council, where are we at now 2 weeks later from the point of that decision being made regarding the $85 million?
So as of right now, as a city, and as of today, we had 604 new confirmed cases. We had 42 deaths, which is one of our most deadliest days that we've had in the city of Philadelphia since the virus started. And
that's just today.
That's just today. From yesterday.
42 deaths. Wow.
Yeah.
Okay.
And so that's puts us at 8,000 total, over 8,000 total confirmed cases, and a total of 253 people in the city of Philadelphia have passed away thus far. And so as a city, what we're doing is we're really trying to amplify our message to encourage people to stay home, to encourage people not to convene, and we're specifically targeting young people that are 40 and under because that is the age demographic that's still testing positive at a higher rate than any other age demographic. And so our goal is really to focus in and hammer our message so that people understand the importance of where we are right now. And we're hopeful that if we can continue to encourage social distancing as well as all-out isolation, we'll put ourselves in a position where we can defeat this.
Gotcha. Are there any thoughts, specifically as it pertains to Philly, any thoughts around why that particular demographic, and meaning those of us who are 40 and under, why we're seeing a higher rate of diagnosis when it comes to COVID-19?
So it can be from a number of different things. Naturally, we're looking at the social dynamics and the fact that you have a lot of people who are in that age demographic who feel like it won't become symptomatic to them, and most importantly, they feel like it won't become detrimental. So a lot of people in that age demographic are still convening in a way that has been discouraged from not just the federal level, but the state and the city level. That's part of it. Another part is that we still don't know enough about the disease to understand exactly what's going on as it relates to the social and cultural dynamics. So I don't want to stereotype any age demographic or any particular group of people, but our goal is to ramp up our message and to make sure people understand that this is serious, people are dying, and we need folks to sacrifice right now so that we can benefit later on.
Yeah. So a couple things I want to make sure we touch on. I've definitely seen data that's coming out now around, communities that are demographics that are being more affected by COVID-19 or disproportionately affected by COVID-19. And here in Philly and like, what we're seeing much around the nation, that's the African-American community. I haven't necessarily seen as much data around underlying conditions, right? I see, and I don't know if this is on the media's part, if this is on the city's part, health department's part, whatever it may be, depending on the state, what information is shared in terms of pre-existing conditions that contribute to, exacerbating the experience of COVID-19. But is there any talk around starting to document the pre-existing conditions in those who are found to be diagnosed with COVID-19 so that we can get a better idea of those pre-existing conditions and how many folks specifically are at risk with each pre-existing condition?
So here in the city of Philadelphia, we have been actually keeping some soft numbers as it relates to not just the zip code that people live in that contract the coronavirus, but also, unfortunately, when people do unfortunately die from coronavirus, we do keep track of information here, specifically in the city of Philadelphia, whether they did or did not have some level of an underlying condition. There is some transparency issues where though there are some folks that feel like the city should release more data and information about people once they've actually tested positive. But when someone does die, that information has been communicated. And if there are folks in the WURD listener audience that would like that information, you can reach out to my office or to the mayor's administration to dive further into those numbers. But outside of that, I heard a smart person say that that this time right now, it highlights the disparities that exist between poor people and other citizens, and often poor people are people of color. And not only does it highlight it, it's amplifying it right now. And so on City Council, we know that. We're aware of it, and we've been doing our best to advocate for as many resources as well as to put people in a position where their homes and their everyday living conditions are essentially protected. We also know that that's not enough because, like I said, these disparities were there long before this. But I think what we're starting to see is more advocacy and more sympathy for what people are going through, which puts us in a position as legislators to hopefully get some things done.
Got you. And one of the things that we're seeing, and for whatever reason, we saw finally get done, is the authorization of about 2 million masks to come from the federal government to Pennsylvania, really in hopes of reaching Philadelphia in particular, or the Philadelphia region. Any thoughts on, number one, the receipt of that kind of support on the front of, on the part of our frontline healthcare workers, and then also on talk around the nation, the outside in general, opening back up?
So Governor Wolf actually today announced an executive order to essentially say that starting on Monday, anybody who walks into a store must wear a mask in the state of Pennsylvania. So it is good that we have the masks that are coming from the federal government, but unfortunately those masks are coming far too late and there are far too few. So with that being said, I'm always concerned, and I try to have a close relationship with our federal legislators. I was on a call this week with U.S. Senator Casey. Earlier today, myself and other members of council were on the call with the congressional delegation in Philadelphia, Congressman Boyle, Congressman Evans, and Congresswoman Skilling. And the things that they're advocating for as Democrats are the exact things that the federal administration are essentially trying to take away from folks. And so while, again, the 2 million masks are a great gesture, this April, 2 million masks should have been delivered to states all across the country in the end of January, maybe February at the latest. And part of the reason why we're home right now is because of the late response of the federal government. So we need way more resources in the city of Philadelphia. I appreciate all the different people who stepped up to donate masks to different essential employees here in the city, from trash men and women to police officers to hospital and healthcare workers, because we need it all. But 2 million is not enough.
I got you. No, I definitely feel you on that. And I'm definitely thinking 2 million is not enough when we now have an executive order by Governor Wolf here in Pennsylvania that anyone who's walking into a store, by your own count, has to wear a mask. But like here in Philly, we see that SEPTA, they first had an order of that any rider had to have a mask, but didn't provide them. But then got to a point, after some negative publicity and some instances that happened, that they started to try to do their part with the reserve that they had to provide masks to riders, and those have been going like hotcakes, right? If they're not even already depleted, and so if we're seeing that kind of thing happen, with SEPTA, with our riders who need to use SEPTA, for essential transportation. Realistically, how is it that every Pennsylvanian is going to be able to have a mask to make these essential runs and go into stores that they need? Like, what do you know anything about the plan to if that kind of order is going to be enforced to make sure every Pennsylvanian has a mask?
So we share the same concern, because I think about that same demographic as well, who might not have easy access to purchase a mask or to be able to get the proper equipment that's needed to make sure that you're able to stay safe. So this announcement is something that recently came down. We, as members of council, have not had a chance to discuss it, but myself and I know some of my colleagues will agree with me, we're prepared to do what we have to allocate financial resources to assure that Philadelphians who do not have it at their disposal has an access to a mask. Our goal is to keep as many people safe and alive as possible, and whatever we have to do as the city, we're prepared to do. So this is something that's rather new for us, just like you and the listener audience. So we're still in communication with the governor's office to figure out exactly what this is going to look like. But from my understanding thus far, they're not saying that you must wear a mask. They're saying you